There being none, let's go on to the next part of your report, Mr. Hager, and that is the introduction of Xerox.
For the record, John Hager. So as stated earlier, the Board of Examiners approved the contract with Xerox Healthcare LLC, and they are here to provide a demonstration, about a half hour, plus questions for the board and the public to get a better understanding of what their product provides. They are contracted, their subcontractors are Choice Administrators in California and KPMG. Choice Administrators provides exchange services. I think they have 5 exchanges set up. And then KPMG is basically a quality control entity. They'll be keeping them on track. So with that, I will turn it over to Xerox and let them introduce themselves and say welcome.
Thank you. If I can get both of you to give your name and introduce yourself for the record, and then I'm going to check with Las Vegas and Dr. Klein to make sure they can see what we're seeing here.
Good morning, Greg Vidiello with Xerox.
Good morning, Joe Dela Cruz with Choice Administrators.
In Las Vegas, can you see the presentation or the...
Yes, we can.
Okay, and Dr. Klein, can you see it?
I'll tell you in a few seconds when the website catches up.
Okay.
Yeah, I can see it now. Thank you.
All right, thank you. Gentlemen, proceed.
No. I think it's a live demo. It's a live demo.
That's a slide.
Are we having problems down in Las Vegas?
There's a question about whether or not this presentation will be made available to the public now or in the future.
Yes, the presentation will be posted to our website so the public can see it. I believe is there a live demo portion of it, or is it all part of the presentation?
There's a live demo.
So the live demo part will not be part of the made public, but the presentation itself will be provided on our website this afternoon.
Morning, ladies and gentlemen. Again, my name is Greg Vidiello, for the record. I'm Vice President for Xerox Health Insurance Exchange and Eligibility Services. And today I'm happy to be here and would like to take a few minutes just to introduce our team. Joe Dela Cruz, who is our project director with Choice Administrators and will be responsible for providing the web demo later this afternoon. I'm also joined back here by Bill DeLang. He's going to be our Executive Account Manager. Jeff DeJura, who's Vice President for Exchange and Eligibility Services. Jennifer Wadham, who is our Solutions Director. Eduardo Garcia, who is our Business Operations Subject Matter Expert. And Matt Benton, who is our Implementation Manager. Today, we're going to spend some time discussing the Xerox partnership for the Silver State Health Insurance Exchange, the roles that the Xerox team members will be playing, why the Xerox team was chosen, and then, as I said, a demonstration of the system that we will be building for Nevada. When the Affordable Care Act was first signed into legislation, Xerox set out to find partners who were best in class in the industry. Xerox, just in case you don't know much about us, we're one of the largest government healthcare services providers in the nation. We have over 40 years of experience serving 38 million consumers across 23 states. Choice Administrators, you may or may not know, was the first private exchange in the nation. The first ever defined contribution exchange, and the first ever ancillary benefits exchange. And they currently service a network of over 30,000 brokers. KPMG is recognized as a knowledge leader in health and human services initiatives. They were a key contributor with the Mass Health Connector, and and are going to be working with us directly to ensure that we're implementing based on the requirements for Nevada. Our solution is comprehensive, end-to-end, and kind of out of the box. Our solution includes a shop and compare, eligibility and enrollment services, policy management, financial services, program maintenance, customer relations, and exchange infrastructure. Just to briefly go over what the various roles are that our team members will be playing, Xerox will have the overall project management oversight for the implementation and ongoing operations. We'll also hold the customer service center and have responsibility for training and reporting oversight. Choice Administrators is developing and delivering the overall solution, which includes the carrier management, financial services, the web portal, shop and compare tools, and the online enrollment, as well as the other things you see here on the slide. KPMG will have the project quality management and overall ensuring that we are implementing based on the requirements for Nevada. So why was the Xerox team chosen? Partly due to the risk mitigation and speed to market. Our existing exchange software covers at least 75% of the individual requirements, as well as 90% of the shop and technical requirements. Our knowledge of the Nevada insurance market. In 2011, you may or may not know that we worked with 1,200 Nevada brokers who produced more than 165,000 quotes and serviced more than 40,000 residents. And demonstrated track record, as we've said before, we have award-winning call centers across the nation and around the world. We've been operating health insurance exchanges for more than 15 years and are currently engaged with 10 different states on HIX engagements through KPMG in Connecticut, Massachusetts, Missouri, New Jersey, New York, and several others if you're so interested. The other thing, I'm happy to let all of you know that we are bringing over 600 jobs overall to Nevada, 40 of which are related to the health insurance exchange, and then there'll be more than 500 jobs in the Las Vegas area with another contract that Xerox has currently won. And with that, I'd like to pass it over to Joe De La Cruz, who will provide you with the system demo.
Okay, good morning, everyone. My name is Joe De La Cruz, Project Director for Choice Administrators. I'm going to take about the next 20 minutes we have allocated for this to go over really the Silver State Exchange. This was a demonstration we created based upon the RFP that was issued and the requirements that were set in there. As you all know, there are many components to the exchange, especially from the actual platform itself, how it services members in a unique customer experience, world-class customer experience, and gets them really to where they want to go so they don't get lost. Purchasing insurance, especially if you're not using a navigator or broker, can be quite tedious. So the idea here is that this exchange portal that we have definitely puts someone through a no wrong door process, walks them through the shop and compare process, into enrollment, and then into actually servicing their plan throughout the year. So what we're seeing here is the landing page for the Silver State Exchange. Quite a few features, lots of ways to contact, get help. They can log into their account if they are currently a member or have an account. But really the key here is that this is the no wrong door page. So we actually have 4 paths depending upon what role you play, if you're an individual or family. We have an employer or small business path. There's an employee path, as well as a broker navigator path. Just because of the time constraints, what we're going to focus on today is the individual and family path. So I'll click on as individual and family. Here I can choose to just simply browse plans if I'm just kind of looking to see what's offered through the exchange, or I actually can go ahead and create an account and start my enrollment process. As we create an account, it's very simple. As if you've gone to Amazon, anywhere else, you've created some sort of account on the web. It's pretty straightforward. And we also have this translated in Espanol currently, so that's also in sight as far as this particular exchange is concerned. So I've got an account created, and just for the sake of time, we've got some pre-populated information in here. So what we're showing is I would build my household information. So we have Daniel Smith, Nevada resident. He is a male. We're going to ask some questions so we can further determine the right path for him and the right products for him, such as household income, primary tax filer. Daniel's also going to go ahead and build his household, the members of his household, and submit some information. Once his household has been built, we're going to submit that over to the SSIO verification process. So at this point, we've captured enough information to send it over to SSIO and have them return some sort of verification of income, of citizenship, of income. So we're going to ask a couple of things here just as a secondary security question before we display the information that we found. So once that's confirmed, it comes back showing the makeup of the family. Daniel Smith, in this particular instance, had an annual income last year of $30,000. Anna Smith, annual income of $15,000. Obviously, the kids, no income there. And current coverage is unknown. If this was a repeating customer coming into the exchange, they would see the prior year coverage. We've also validated that everyone in the household is a U.S. citizen and everyone is a state resident. At this point, if the applicant felt the information was incorrect, they could process a correction request. If they felt the information was correct, they could go ahead and move on to the next step. So based upon that information, the system does some pre-eligibility determination, saying based upon what we know of your income in your household, you could be eligible for low or no cost health care plans. Would you like to check eligibility? At this point, we would have the state application up. This is just an example of the application. We would be obviously looking at the state's eligibility system to build out the questionnaire so they can fill that out through the exchange. So at this point, we've just got some high-level questions. I'll go ahead and put in that Daniel's disabled. Once that application has been completed, we then hit the state's eligibility rules engine. And that's going to return eligibility response. So in this case, Daniel would be eligible for Medicaid based upon his disability, and it would be eligible for a subsidized individual plan, and the children would be eligible for CHIP. We also envision, since they're eligible for government-assisted health care, they may also want to check eligibility for non-health care public programs such as SNAP or TANF. If they felt the results were incorrect, they can go ahead and process an appeal form right through the exchange as well. If everything seemed to be in order, they can continue on to the next step, which is really the shop and compare process. Move back up. So this is the shop and compare piece that we have. Obviously, there's lots of elements, probably one of the busiest areas of the exchange that we have, but it's also the most informative. So I'll walk through kind of the key pieces here. Off to the left-hand side, we have an out-of-pocket calculator. We also have further filters that the consumer can filter by: metal types, monthly premiums, deductibles, things of that nature. There's also a physician finder and an RX finder. In the middle, we actually have the summary of the plan that they're considering at that point. They can also add that into a comparison so we can do side-by-side comparison. So we'll get back to this family makeup. As we recall, Daniel was eligible for Medicaid. In this particular instance, Medicaid, there is just one plan, so kind of a no-brainer there. We'll go ahead and add that right into the cart. The next set of folks I'm going to shop for is for Emma and John, and that would be the CHIP program in Nevada Checkup. We'll go ahead and enroll them into that plan. And then the last one here is going to be for Anna. She is the one that's eligible for a subsidy into a commercial program. And this is where I'll go ahead and do some of the cost comparisons. So as you see here, we've got some illustrative plans. Obviously, these are not the actual plans that will be out there. They're still being written or being designed, I guess is the best way to put it. But we have we show some annual out-of-pocket, deductible, office visit, generic, specialist, some of the key things that people would care about when considering the plan. They could further look at benefit information by clicking on plan details and looking at the other benefit designs of that plan. There are sorting options available to them as they move forward. So what we have off to the left-hand side is the out-of-pocket calculator. Right now we have it set to some typical usage patterns. However, the user, the applicant, can actually adjust those to what they feel is applicable to their needs in the coming year. So primary care office visits, they may say, I'm going at least once a month. I don't anticipate any emergency room visits, no 2 specialist visits, and I don't take any brand drugs, but I do take 4 generic drugs. And what you're going to notice that out-of-pocket cost is going to start to calculate based upon the usage inputted into the cost calculator. And this is applied towards all plans being considered. So if we move down, we'll see that our annual out-of-pocket increases based upon the plan design. The applicant also has the ability to do side-by-side comparison of plans. So I'll move down here and grab a few. And we'll click compare plans. So there's a side-by-side comparison of the different benefit types and the levels there that are offered. So really, once the decision's made, they would go ahead and simply add that to the cart. And at this point, Daniel knows that he's got coverage for Medicaid. He has his children, Emma and John, in CHIP. And Anna is now in the United Healthcare Saver 90 plan. It's total monthly premium. And at this point, he would go ahead and apply. We would then direct them either to an online application, which obviously is a preferred route, or, if needed, print and mail application. That is the mixed eligibility for individuals and members. That's the demonstration we have here for this path. Is there any questions at this point?
Joe, just let me ask a question. If you scroll down further,
Yes.
the first couple of them show a subsidy, but
That is
as you
correct.
go down further, it doesn't, there. You don't show a subsidy on that? Is that just because you haven't populated it, or?
No, the way that the subsidy works is that it's going to be subsidized based upon the silver level plan. So the subsidy would apply to that plan the way that's being interpreted right now. So if you were to choose a bronze or gold plan, the subsidy would not follow into that plan. But again, this was just an illustrative example.
So those are non-qualifying subsidy
Correct.
plans that you can choose?
Non-qualifying
Okay,
plans.
thank you.
Madam Chair? Can I ask a few questions?
Sure.
Thank you. For the record, Charles Duarte. So for the enrollment choice, and I'll talk specifically about Medicaid because that's what I do, the applicant, will they be given an option of Medicaid HMOs as well as our traditional program, or do they have to apply separately for that?
So that is part of the design discussion that we need to
Okay.
have with the state.
All right.
So we know that the state's existing eligibility system will have, really what we're doing is we're providing the no wrong door approach so they understand what's available to them. They may branch off directly into the state's eligibility system to complete that application in whatever way it's being done today. Or we can decide to go and incorporate that into the overall application that would happen from the exchange and funnel that enrollment eligibility information over to the state entity that would go ahead and essentially make that active.
And so, obviously, we need to talk about that. The sort of corollary question is whether or not, if they are Medicaid eligible and enrolled in an HMO, a Medicaid HMO, whether they would be able to select their PCP similar to what they do with an exchange plan. So that would be another issue I guess we'd have to bring up and discuss. And then premium collection. Our Nevada Checkup or CHIP program has a monthly premium.
Yes.
And you're aware of that. Good. What would your plans be for families that don't have a credit card?
That don't have a credit card, so they would they pay by check or pay by cash?
I assume check or cash. We receive both.
Okay. So the way it would work right now, depending upon how this happens, is we definitely take check payments through our lockbox services.
Okay.
Our lockbox service also does take cash. If we get people that will put in the mail a bunch of quarters, to be honest with you, and we actually will go ahead and process those. What we don't have are retail outlet centers or somewhere to where we could collect cash that way, and that's something we would need to consider if that's a requirement But there's lots of different ways to solve that. If there's currently a cash collection vehicle out there where someone can walk up to a brick and mortar shop and put down their payment, we would work with the state to how do we track and record that payment and deposit those funds.
Yeah, that type of recording and documentation and then reporting to the state is going to be important for us to maintain and report back to the federal government. So anyway, thank you very much for the opportunity to ask some questions.
Great.
Any questions from Las Vegas? How about you, Dr. Klein?
Sorry, it's Dr. Klein. May I ask a question?
Yes, you may. Go ahead, please.
Thank you. Sorry, I was on mute. Just a couple of questions. First, it looks like a beautiful system, so my compliments. This is obviously our face to the world, so it's nice to see a nice portal. Perhaps it's my lack of understanding, but I sort of always imagined families buying insurance as opposed to individuals. So in that demonstration you had the child with one system, the mother with another system, presumably the husband with a different system. So how does this work if a family, if the families, how does the family become eligible for the exchange?
That's a great question. So in the scenario that we had played there, that was the mixed program eligibility and how they would enroll into both commercial and public programs. Typically a family would qualify overall. You would enroll them all into Medicaid depending upon certain circumstances. This was probably one of the more complicated scenarios based upon eligibility rules. But yes, a family would go in and shop for a singular plan. They would go ahead and cover the entire family in a typical IFP type scenario. So I would go with the HMM40 with my 3 dependents, and that would be my information. So the portal itself does support that. So we were demonstrating more of a mixed program where I need to have one. We've got a different plan comparison for the CHIP program versus the Medicaid program versus a commercial program. I hope did that answer your question?
Yes, yeah, it did. Two quick questions, 2 more quick questions. One, you're going to support PayPal, I presume, when you talk about credit cards?
Yes, absolutely.
Okay. And then the final question, when I saw the website and I saw everybody's name and birth date and social security number, I was thinking that was really an identity thief's paradise that you were showing. So I presume there's going to be some very heavy security so that what happens so often where people lose their identity through a website won't happen here.
Absolutely. So there are very strict security procedures around the website itself, and then also capturing that information in a HIPAA high-tech compliant fashion. So we're very familiar with that, and we hold that very true and tight to our.
No, and I'm sorry, I'm not hearing you terribly well, but I guess the question would be: so somebody has just like on Amazon or eBay or whatever, you have a name and a password.
Oh.
It just seems like if somebody gets a hold of your name and password, or just through brute force computing, figures out your password, they have access to your whole family's social security numbers and birth dates, and your identity is gone.
Very good. No, I understand that. So that's masking of that vital information that should, that needs to be private. Yes, actually, again, this is a demo system. In our production environments, we allow for input of social security number. However, when it's redisplayed, it is masked. So we'll show the last 4 digits and nothing more. That's both
Thank you very
social
much.
security and credit card.
Madam Chair, Lynn Atkins.
Yes, go ahead.
And this might be a question for Mr. Hager. I wonder if it's possible at our next consumer assistance meeting to have this maybe 10 or 15-minute presentation of how the web portal is going to work. I think we've been working with information that we've kind of been imagining, and I think this, to me, starts really clarifying the role of navigators, the role of brokers, the role of assisters, or whatever terminology we're going to use. I think as fabulous as this system's going to be, I still think it's clear to me there's going to be a lot of people who aren't familiar with computers, who aren't familiar with the filters and how you kind of use this website. And I think this will help our discussion about navigators and brokers and producers and everything. So I don't know if that's possible, but I do think it's actually critical, and I would ask that be done maybe at the beginning of our next consumer assistance meeting.
For the record, John Hager. So a question to Xerox then. Our next Consumer Assistance Committee meeting is on August 29th, on Wednesday, August 29th at 1:30 p.m. Can you have somebody here to provide this demonstration at that point too?
Yes, absolutely. We'll commit to that.
Thank you very much.
I have a question, quick question.
Go ahead.
Hi, this is Dr. Ford. Yeah, hi, quick question. What do we know about the turnaround on IRS verification? You know, in this presentation, it happened in about 4 seconds. Do we have any more information about what is the real-time turnaround on that?
For the record, John Hager, we do not. We've been asking that. They are sounding more positive as time goes by, but the latest official answer is that real time could be 24 hours. So that is certainly a concern for us. It's a concern for Xerox, for all the states and all the vendors out there that are working on this. We will continue to push to make that as real time as possible, preferably within about 15 seconds. I think that's kind of the standard, what we would hope for. Obviously, if this goes to a 24-hour turnaround, we've got to completely rework all of our flows. At this point, though, we need to proceed as if we will get that real-time turnaround in about 15 to 30 seconds.
Thank you.
Any other questions from north or south? All right, thank you. You want to proceed?
Yeah, actually, that was the end of our demonstration. Just like take it back over to Greg, but on behalf of our partnership, looking very forward to working with the state of Nevada and getting the Silver State Exchange up and running.
And that's it for our presentation, unless you have any additional questions for myself or a team member.
Okay, knowing that that's the end of the presentation, I'll ask one more time. Are there any more questions from board members? Or from the state with regard to this? I know, Chuck, you asked. Okay. All right. Well, thank you very much. We appreciate you being here today.